Hi, I'm Dr. Frank Ergetz from the Sinus and Allergy Wellness Center of North Scottsdale. Nasal breathing. The importance of nasal breathing is multifactorial. It gives us a good quality of sleep at nighttime, helps to keep the air clean for our lungs, it helps to provide an airway for our smell and our taste, and provide a clear channel for sinuses to drain. The nasal pathway is divided in half by a structure called the septum. It's made of cartilage, which is shown here in blue, and the tan represents the bone that evenly divides the nose in half. The structures that hang down from the side of the nose are called turbinates. The job of the turbinates is to warm, to clean, and humidify the air that we breathe through the nose, so that as the air comes through the nose and cycles around these turbinates, it comes down to the back of the nose, down to the back, through the throat, back in this region back here, and then down into the lungs where we breathe that air, down into the back of the throat where we breathe that air into the lungs. Nasal blockages occur sometimes from septal abnormalities, such as deviations. Polyps could be inside the nose blocking airway, as well as turbinate enlargements. And finally, another structural component of weakness could be the nasal valve, which we'll see in just a second. These cartoons show the three different areas of nasal obstruction. The first being the deviated septum. This is the abnormal septum shifted off to the patient's right side, where ideally it would be nice and straight in the middle, evenly dividing the nose in half. The second abnormality would be the hypertrophic enlarged inferior turbinates, which just physically block airflow through the nose. The third area of blockage can be the weakening of the lateral wall coming from a nasal valve collapse. If you take a close look at the side of my nose, right in this region here is called the nasal valves. As I breathe in aggressively, you can see my nasal valves collapse. This is the third area of nasal blockage that can be addressed here in our office. Typically, when we see patients with nasal breathing problems, we want to help them feel better and breathe better through their nose. And we start at the easiest maneuvers, we work our way towards the more difficult option. The easiest treatment for us to help patients breathe better through the nose would be the nasal turbinate reduction. We do that right here in the office. It takes roughly 15 minutes total time for the patients to come in, get anesthetized, have the procedure done, and then leave. You could actually drive here to the office, have the procedure done, and then drive home safely. The second treatment option would be the nasal valve approach, which is a way for us to help to improve the area of breathing on the corners of the nose by placing a dissolvable stent into the lining of the nasal cavity to help keep the nasal cavity open long term. As time passes, the stent dissolves and provides some scar tissue that forms in this critical area to keep the nasal airway open. The final option that we have to treat patients would be a nasal septal reconstruction, which is typically done in the operating room under general anesthesia.